Hello, this is Chris from the Obstacle Doc, and today we're going to talk about ideal posture. We're going to utilize the picture here to kind of get a little bit of a frame of reference, and then we're going to show this on a real world example. This is kind of foundational. This sets the stage for a lot of things that we do in terms of a rehabilitative map. When we think about proper position, proper posture, I often tell patients, think about your car and your car having a properly aligned system, or as your car as a bad alignment. We can still drive our car, do our stuff, but there's wear and tear going on inside the car as you're doing that. Our bodies, in a way, regarding posture is fairly similar. So we have our ideal position that we would like to kind of place ourselves when we're at positions of rest, positions of sustainability or static positions like standing, sitting, and positions of movement like squatting, lifting, running, jumping. So in the context of proper posture, we're going to focus on this middle illustration here. What this is demonstrating is the proper orientation of our head over our shoulders, over our hips, through our knees and ankles. So best case scenario in this orientation, the ear rests over the shoulder, the chin is at a right angle, forehead is leading forward. As we work our way down, our shoulders are in line over our hips, over our knees, and over our ankles. So that if we are in this position, regardless of a person's body composition, weight, or frame, so when we do this, it doesn't really matter. It's kind of applicable to all cases. Because all in consideration, if we're in that proper position, I should be able to draw a straight line down someone's back so that I can maintain 3 points of contact: the back of the head, the shoulder blade area, and the tailbone, so that there are 2 prominent curves at our neck and at our low back. Now, the other key area that we want to focus on is also the pelvic position. The pelvis is kind of like your keystone to your body. It's what your spine funnels into. It's what your legs funnel out of. Where your pelvis is positioned in space is critical because we need that to be very level as our foundation. I often use the analogy of a cereal bowl resting on a table. We want that bowl to be level. If that bowl is tipping forward or backwards, that cereal is going to spill either forward or backwards. But it also throws our line off as well. So another way to look at it is, if you think about our pelvis, we have 2 bony bumps in the front of our pelvis, and I should be able to draw a straight line going horizontally as well, kind of parallel to the ground. All right, so here's our real world example with Daniela. So when we try to set up proper posture for her, analogous to what we did on the illustration, if I take our stick, ideally, I should be able to rest it against her back so that we have our 3 points of contact while she looks forward: the back of the head, somewhere in the shoulder blade region, and at her tailbone. Things that we're looking for as we're doing this: her chin should be level at a right angle. Her forehead is facing forward. Her pelvis should also be level. So we think about the 2 bony bumps on the front of the pelvis. We want to think about those like headlights of a car. We want those to face forward so that if I place the stick here, that is level with the ground. Compensating wise, if it tips down like this, that's going to increase the arch in her low back. Now, she may still have her 3 points of contact, but her pelvis is out of position. So her cereal bowl is tipping forward or down, creating a much more excessive lumbar curve. So to correct it, it's a degree of relative, but we are tipping posteriorly only to the point of getting level, still maintains her curve. Now, you can also do this yourself. So you can take one hand, you can rest it above, one hand below, and you can challenge yourself to try to line up on these 3 points of contact. I'd recommend doing this in front of a mirror so you can also watch where your head-neck interface is. Again, you want the forehead to face forward. You want the chin to be level. Oftentimes we'll get in this position, but we're looking up. So we want to tip that head in a proper position as we go. So this will give you an idea of what proper position actually really feels like. And for many of us, this is challenging just to get there because a lot of us tend to be either a little rounded forward think of all that repeated movement, computer, driving, life tends to kind of pull us forward. Our phones tend to pull us forward. So if we can get on this line and start to understand that, you're gonna probably feel responses in the body. So you may feel some stretching, tightnesses. You actually may feel some fatigue in musculature throughout the system because this is active. You are holding yourself in a different position right now. And at some point, those muscles might actually start to get tired. So when we teach this in the clinic, we don't expect this to be 100% all the time. That'd actually be impossible. And our body is resilient. It is meant to go out of position. That's okay. But what you really want to start to think about is the adaptations that can occur over time if we maintain a position that is opposite our ideal posture. So best case scenario, learn the position, learn how to be static with it in sitting and standing, learn how to be dynamic with it in walking, running, all your movements of choice, and developing that new adaptational response to the system so that you can get more used to this and not the opposite perspective.